Hello, and welcome to Health Matters. My name is Larry Williams, and I'm your host. It's been a while since we've been on, but we're happy to be back. And once again, what we're going to do in Health Matters is discuss issues related to health as they relate to people of color. Again, welcome back to Health Matters. My name is Larry. Our guest today is Josie Rodriguez. She's been with us before, and we're going to talk about the agency that she is in charge of or administrates. Welcome, Josie.
Thanks, Larry.
Why don't you tell us a little bit about yourself before we get into what do you do as the administrator for the Office of Health Disparities and Health Equities?
Okay, I began the position in 2011, and what I do is really administer all aspects of the office. So we have a budget that we're responsible for. We oversee many grant programs, so we're responsible for that as well. And I oversee about 13 staff. So okay. It's a lot of the administrative stuff in the office.
Now, you've been involved in this field for a number of years. Maybe you can tell our audience a little bit of some of your experiences in the past.
Yes, I have worked for the state for, over 20 years. I worked in different agencies within DHHS. I worked for DHHS for Medicaid. I also worked underneath Child Protective Services, but I worked for the Office of Minority Health, which it was called before, in Lexington. So there's congressional districts that our office has, and I worked in Congressional District 3.
Okay, thanks, Josie. Well, let's talk a little bit about the Office of Health Disparities and Health Equities. Maybe you can tell us a little bit about the history and the origin of that office.
The office was created in 1992, and it began because of an AIDS task force. Oh. So there was some people meeting around AIDS in Nebraska, and the task force talked to the director of the health department at that time and looked at that there was a need to look at the rates of AIDS in minority populations. From that, there was a Minority Health Coalition that was formed, and then they really went to the director and asked to have an Office of Minority Health be created in 1992. So that's when it was actually started. Okay,
help me with my math. 1992, that's well over 20 years, I think. Okay.
Yes.
All righty. Well, why don't you tell us, what do you do as the administrator of the Office of Health Disparities and Health Equity? I always like this question, what is a typical day like for Josie Rodriguez as the administrator of the office?
Well, we oversee, like I said, many grant programs, so a lot of it is looking at the details of those grant programs. We're really trying to move toward evidence-based practices, and so a lot of it is working with other agencies on how we can get the best outcome for the dollars that we grant out to agencies. We also have many different activities within our office. We do a lot of different programming, so it's working with the staff to take that programming out to the communities. Mm-hmm. So a lot of communication with other partners out there, and then working with internal programs as well. So a day is very different. Sometimes you're working on a budget, sometimes you're working with community members, sometimes you're working with health department directors, so there's a lot of different things that happen throughout the day and the week with our office. Mm-hmm. But this is a great time to be talking about minority health, because it's April is Minority Health Month. Mm-hmm. And so the theme is advancing health equity. So thank you for having us on and talking about minority health.
Glad to have you, glad to have you. You mentioned a term that I'm familiar with, but I think there's a term many of our audience probably will not know. And we're moving in that direction when it comes to any type of program, and that is evidence-based programming and outcomes. Maybe you can just talk a little bit about what that means, because I don't know if folks in the audience have ever heard that phrase and understand it.
Well, let me kind of frame it in how we're using it. We oversee Minority Health Initiative projects, and those projects are, money came to the state from the tobacco settlement dollars. And so we are responsible to oversee those dollars. So funding goes out to counties that have 5% or more minority populations. In Lincoln, Lancaster, the project currently is overseen by Lincoln Lancaster County Health Department. In July of this year, a new award will go out to the Indian Center. They have many partners in their project, and when we talk about evidence-based with our new projects, we're really talking about programs that have been researched to work with communities. And so we're really trying to push that. And so there are a lot of different evidence-based programs, evidence-based strategies out there. So it's just a program that's been researched to be able to work to get to outcomes, or strategies that work, such as maybe an intervention of using a community health worker or a lay health person to help improve someone's health.
Okay. In some ways, you could say it's the best practices that have been researched or uncovered that seem to work for a particular problem that you're trying to solve.
That is exactly right.
Okay. All right. So you get the best bang for your buck.
That's right.
Okay. All right. Well, what are the priority issues for the Office of Health Disparities and Health Equity?
You know, one of the main things that we do is let people know that there's disparities out there. A lot of times people think that the health of everyone is equal, and it is not. There are many disparities, so that's one of the big things. Another thing that our office does is provide data. And one of the things that we do is we provide reports. In those reports, we demonstrate the disparities, and then we actually show the difference of the health of the minority population compared to the white population. Mm-hmm. We also do a lot on cultural intelligence, which is kind of like cultural competency. We try to enhance the skills of individuals on that. And then we work with partners. We work with a lot of different partners because it's not just our job, the Office of Health Disparities and Health Equity's job to do all of this. It's going to take partners. It's going to take all of us doing it.
It's a collaborative effort.
That's correct.
Okay. The last time we visited, and I think it was about 2 years ago, some things have changed, and so maybe you can talk just a little bit about some of the new challenges that your office has faced or that's uncovered, or new issues that the office has uncovered since the last time we talked about your Office of Health Disparities and Equity.
You know, there's always challenges around health disparities, and so we have seen that there have been some progress made. For example, infant mortality rates have decreased for all populations. Unfortunately, they continue to be high for African Americans, but we've made some efforts there. And then obesity is rising. And when we look at the recent report that we're going to put out, obesity is one of the areas that we need to really do a lot of work on. And so that's one of the challenges that we're looking at. We did put some evidence-based strategies into this new grant, the Minority Health Initiative grant, and so that is something that we're working on in that grant as well. And then social determinants of health, that's always a challenge when you look at disparities, because a lot of times people think, you know, it's the individual's fault because they're not doing this or that. But there's so many different factors that come into health disparities, and social determinants of health is one of those. And when I say that, I mean environmental factors in the community that are out there, like the need for good sidewalks, the need for safety in neighborhoods so people can go out and walk, good housing. So there's a lot of different factors that come into play. So that is a challenge as well.
I think some people in our audience might not think in that way, and that's a sense that there are other factors that play a role in one's health. In addition to just preventative care, there could be other factors such as housing, such as food, or transportation.
Correct.
Plenty of issues that affect one's ability to maintain and prevent and have good health.
Yes, language access issues.
Right, okay. Boy, you work with a lot of agencies. You kind of talked about the collaborative efforts that you have. Maybe you can talk a little bit about those collaborations. We're going to talk more specifically in the next half about the Minority Health Initiative and other programs, but maybe you can talk just generally a little bit about those other organizations that you work with.
Well, our office works with not only our internal offices within the Division of Public Health at Department of Health and Human Services. So we work with the chronic disease staff, we work with maternal child health staff, but we also work outside of DHHS. So there are many public health departments out there. We work with pretty much all of the health departments that are out there. We work with the universities. We also work with community-based organizations, and then we also work with the community itself. So as I mentioned earlier, it takes all of us to be able to make this collaborative impact in what we're trying to do. And so we try to have conversations with all of those partners.
Okay. Let's talk a little more specifically. We're going to go ahead right now and talk more specifically about some of the programs that you actually administer. I mean, so those concrete things. Let's talk about the Catch Club Kids program. What's that?
Catch Kids program is an evidence-based obesity prevention program for children. And so when we looked at this program, we knew obesity was rising, and we wanted to help do something about it. And so we work with the Catch Kids organization, and we purchased kits. So what we do is we go out and work with community-based organizations and schools and bring this program in. It's a 6-week program that organizations can do with children. Our focus, of course, is minority youth. And so we're trying to just decrease those rates. We know that the rates are high among adults, but it starts with our children. So decreasing the rates of children is what we're trying to do with this program. And so like I said, we're working with schools, community-based organizations, churches, whoever's interested in having this program, the 6-week program. We actually train the individuals to provide it, within the organizations to provide this, and then we provide actually all of the equipment. So we check it out to organizations. So any organization that's interested in checking that, the information out, the equipment out, and working with us and being trained, we are willing to do that because we want to help with the obesity rates.
Mm-hmm. Is this a focus on elementary school, middle school, or high school, or just a whole gamut?
It's more of elementary and some middle school.
Mm-hmm. Okay. Do you have any idea how many people are participating within the Lincoln area in that? Just a general number?
You know, we have probably done programs with, at least 10 organizations.
Okay. Mm-hmm.
And I would say probably have worked with over 150 students.
Wow.
Yeah, so it's really, what we're trying to do is really build it in the curriculum that organizations have so that it is sustainable.
Okay. In other words, it's just not the special program that comes in, but it becomes part of the curriculum.
Correct.
Within the schools, within that particular school, to fight obesity.
Correct, and one thing the program does, it doesn't just look at physical education, it also looks at healthy eating.
Okay.
And so it combines both and then also works with the parents as well.
Mm-hmm. The whole healthy eating thing that you were just talking about also kind of comes back to environmental concerns and also whether or not folks are actually going to the quick shop to do grocery shopping, or are they going somewhere else to pick up what we would be healthy eating, healthy foods.
Yes, that is correct. That is correct. They actually do cooking lessons with these children in this program, and then bring the parents in too, so that they can the parents can learn from the children, but the children are also learning as well.
Right, okay. I think we're going to take a short break here, and then when we come back, I think we're going to talk a little bit about cultural intelligence and what all that is about and what type of programs you provide in your office. We'll be right back after this short break.
This is Max. 13 years from now, he'll try pot for the first time because he just wants to fit in. This is Katie. 12 years from now, she'll find a new group of friends and start skipping school. This is Aaron. 10 years from now, he'll be bullied by his classmates and become withdrawn. Raising kids is hard. It's okay to ask for advice. Call 888-866-8660 to speak to a trained counselor. Any problem, anytime.
Welcome back to Health Matters. My name is Larry Williams, and our guest today is Josie Rodriguez. We've been talking about the Office of Health Disparities and Health Equities at the Nebraska State Department of Health and Human Services. We're going to continue now with specific services that are offered by the Office of Health Disparities and Health Equities. We've talked about the Catch Club Kids program. Now we're going to talk about something called cultural intelligence. And I think we're going to need a little help in sort of understanding what that means and why it's important. Okay. Go ahead, Josie.
Well, when we say cultural intelligence, what we were trying to do is enhance individual skills in working in culturally diverse situations. We used to title it cultural competency,
right.
But oftentimes people hear the word and they think I've already taken a class and so I'm done and I'm knowledgeable about everything. And so that's why we changed it to cultural intelligence. What this curriculum is, it's a training that we provide, and it's 2 days, but we can chunk it into 1 hour trainings, which we do offer CEUs, which is great for professionals. But what we do is we talk about culture in a broad sense, Larry. A lot of times people think of culture and they just think of race and ethnicity. Mm-hmm. And when we talk about it in our training, it's more about one's own culture. And so what this training does is it looks at different aspects of culture, looks at history. A lot of history determines where we are today. It also looks at individuals' past, because what you've gone through shapes who you are today. And that really has a profound effect on how you look at different things. And so this training just offers an individual to look at where they've come from, some of the biases they may have, and just provides them with tools on how to work with culturally diverse situations. So it's a really good training, and people really take a lot from it and learn quite a bit. So it's just really a training that will build on individual skills to work in culturally diverse situations.
Oh, I'm assuming this training is available to, let's say, county health workers, or who is the training available to?
It's available to everyone. We have provided trainings to DHHS employees. We've provided it to daycares. We provided it to, our staff is actually working with Roper and Sons on it. So public health departments, health professionals, anyone who is interested in really working with individuals from diverse backgrounds, but also just working with individuals. You know, we call it P3, it's working with people. It's not just working with individuals that are from diverse backgrounds, but people are people. Everyone is different. Just because I'm Hispanic and my sister is Hispanic doesn't mean that we see things exactly the same way. And so it just offers individuals an opportunity to think about things differently.
One of the things I noticed that I caught is that you offered it to a mortuary because funeral traditions and services differ.
Correct.
Based upon your history, based upon socioeconomic conditions, based upon your ethnicity. It's a whole realm of factors.
That's right.
And so it's available to everyone in our
Yes,
community.
and it is free as well.
Okay. Now let's say, for example, folks are interested. There might be some organizations or businesses that are interested in that. Who would they contact? Your office? You
Yes.
just specifically?
They can contact our office. The phone number is 402-471-0152.
Could you repeat that one more time?
Yes, 402-471-0152.
Okay. Let's talk about the program that I'm very familiar with, since my daytime job is the director of the Malone Community Center, the Minority Health Initiative. Maybe you can give us a little background about that initiative and where we're at right now with that initiative.
As I mentioned earlier, the Minority Health Initiative was created when the state got the tobacco settlement funds. So when that happened, they created health departments, which was a wonderful thing that Nebraska did. But another thing they did is that they put money towards minority health. And so this funding, our office gets $1.5 million per year, and we grant that out to organizations, I should say counties that have 5% or more minority populations in those counties. So any organization is eligible if they need to serve those individuals in those counties. This current year, we have approximately 17 grantees, and a new grant period will begin July 1 of 2015, where we will have 19 grantees. In Lincoln specifically, as I mentioned earlier, Lincoln-Lancaster County Health Department has had that project quite a few years, and they really look at collaborative effort around some partners here in Lincoln, and they want to really look at increasing medical homes for individuals, and they also provide some dental services, and they've done a great job at that. This new funding, the Indian Center was awarded that funding, and they have quite a few partners as well, so they're going to kind of try to continue the collaborative effort within Lincoln, and they're going to work with a variety of partners, which I think that the Malone Center is one of those, as well as El Centro and some other partners out there.
Right. I think we're going to probably be seeing some film here while we're talking more about the Minority Health Initiative, and these are various events that have come about as a result of this initiative, where there are health screenings and information on healthy lifestyles, healthy eating, et cetera, et cetera. I think one of the things that's kind of interesting about the Minority Health Initiative is how it has grown and how important it is. And maybe you can let our audience know, why is it important?
It is important because we're still seeing disparities. You know, we will have a report coming out here, hopefully the beginning of summer, that really demonstrates the improvements and some of the things that we need to improve on. We look at Healthy People 2010 objectives, which are national goals for states. And when we look at the difference between 2001 to 2005 and 2006 to 2010, we've made some improvements in a lot of areas. But some we still need to focus on, like I said, obesity. And one of the things that this grant funding looks at is cardiovascular disease, obesity, diabetes, so some of those big chronic diseases. And this funding is really helping with those. We are seeing some improvements in those, although we still need to do some work in some of those areas as well.
Sure. And again, I think our audience has seen some of the scenes from one of the events, Take Time for Your Health, and maybe another event. But again, the purpose is preventative care, letting folks know or they are aware of their health. And I think maybe you can talk a little bit about the importance of prevention in the whole realm of health disparities.
Yeah, prevention is very important. In the new grant that we have, as I mentioned, we're looking at evidence-based practices, but some of that is also prevention. We need to let individuals know what their numbers are, and some of these events, as you mentioned, provide that information, because oftentimes they're maybe not able to get to the doctor because of they have to work or something, and these venues provide spaces for them to do that. So prevention is very important, and yes, the dollars do go to screenings and linking individuals with healthcare providers and finding them resources.
Correct. I think there are BMI screenings, diabetes, blood pressure, tobacco cessation, and dermascan and FOBT kits, and also free breast exams are also part of some of the events that the Minority Health Initiative has helped in our community sponsor. Okay. Anything else from your office? What about reports and research? I think that's a very important part of what you do.
It definitely is. As I mentioned earlier, one of the priorities is data and providing information about disparities, and that's what our reports do. We've done quite a bit. We have an epidemiologist on staff, and he does quite a bit of work looking at all the information. We recently released some socioeconomic status reports, and we are working on a big report, a health status report for all racial and ethnic minorities and American Indians in Nebraska. And so that's the one I was mentioning, that it will show the difference between 2001 all the way to 2010 and some of the outcomes that we've made, which have been really good. And I do attribute some of that to the Minority Health Initiatives. You know, because of the funding that we have been able to make some great efforts.
Good, good. We have about 5 minutes left, and I actually have 3 more questions. So I'm going to go right through these because there's some important information we want to share. Can you tell us the role of the Minority Health Council?
Yeah.
What is that?
Our Minority Health Council is they're a group of individuals that are appointed, and they provide advice to our office. So, for example, the Minority Health Initiatives, we do a request for applications. They will help us with that. They'll provide us with some advice and information on what is going on in their community. If they are seeing some issues around healthcare, they'll let us know. And so we provide them with information and they provide us with information. But they're really just an advisory group for our office that's comprised of individuals from across the state.
How does one become a member of the Minority Health Council? Is that a governor appointee?
No, it isn't. It's appointed by an individual within the Department of Health and Human Services. So our Director of the Division of Public Health appoints them, and all they need to do is send a resume to our office, and we do provide that to the council, and then they will, if they vote on that individual, they'll provide it back to the Division of Public Health Director, and then he will appoint them.
Okay.
So it's a fairly easy process.
Okay.
But there is information on our website, both about our reports and Minority Health Council, if individuals are interested in getting more information about that.
Okay, that's great. Opinion. Health disparities among people of color. Increasing, decreasing, remaining the same. What are your thoughts on this? I think you've said in some areas better, in some areas not so much better.
Yes. You know, as I mentioned, you're right. Some areas have we've done a really good job at, such as infant mortality and breast cancer screening, and a lot of different areas. We know obesity is rising across the nation, not just among racial and ethnic minorities, but among all people. So obesity is one area that we want to focus on. Diabetes is very high too among our racial and ethnic minority populations. So those are some of the areas that we need to continue to focus on, which is why, again, our Minority Health Initiative grants are really more focused, and we're really trying to enhance the technical assistance that our office is providing to those grantees so that we can continue to see outcomes in the areas that we've improved on and hopefully reduce those rates in those other areas.
Okay. So not so much in some areas, just not so much improvement. Okay.
Correct.
All righty. Well, this is our last question. We have about 2 minutes left here, and I think this is one that I always like to conclude interviews with, and that is, you know, why do we need this office? What have been the significant contributions of the Office of Health Disparities and Equity? And maybe you can just tell our listeners, you know, why.
You know, our office is important in many ways. Our demographics are shifting here in Nebraska and in our country. And so as our population continues to become more diverse, it's important not only to be able to work with individuals from diverse backgrounds and diverse perspectives, but also to be able to improve the health of individuals. And our office is able to provide that. As I mentioned, we have our cultural intelligence trainings. We provide a lot of data around health disparities. If we weren't here to provide the data, people wouldn't know about that there are health disparities, and they wouldn't know some of the programs that are out there to be able to improve on some of those health disparities. So it's very important to, data always drives what you're doing, and without that, we really wouldn't be where we're at today, and without the Minority Health Initiative dollars that we oversee and really try to provide impact with those dollars. We wouldn't be able to see some of those outcomes either. So I know that our office provides a very important service to not only the state, but to the community as well.
All righty, okay. Well, thank you so much, Josie. I think you've done a wonderful job of explaining to our community what your office is all about and the significance and importance of that office, and more importantly, that there are health disparities amongst our populations here in the city of Lincoln and the state of Nebraska. So thank you so very much for being my guest, and thank you for tuning in to Health Matters with Larry Williams. We will see you next time, where once again we will be dealing with health issues in our minority community. See you next time, and take care.